This station is implementation, which is one among the APIE stations. So this is going to take like 15 minutes, okay? So in this, you're going to do is safe administration of medication. So of course you will be having a scenario given, and please see what is the timing which is mentioned in that. So sometimes it will be 8 o'clock, sometimes it will be 12 o'clock. So please adhere to the timings which is mentioned in your scenario. So that is the first thing you have to do. And then second thing you have to be careful is like when you check the ID of the patient, cross check with the paper which you got the scenario, and then with the patient what he or she tells, also with the ID band. And then after confirming the ID, you have to go through, because you will be having like 3 or 4 pages of administration chart or record or drug chart. So you have to see the name of the patient and the details, that is the addressograph is same in each papers, each sheets. So you have to turn over the pages and you have to check for the details. So that is one thing which is important when you check the ID. Then as usual, go for gaining the consent and check for allergies. And another thing is like when you check the allergies, you have to cross check with the chart as well. Then as usual, when you since this is an administration like drug administration station, you have to go through each and every page of the drug chart, and you have to read out the prescriber's name, time, day, dosage, and also the timing as well. And if you see there is something which is unsafe to give, there are certain codes provided in the first page of the drug chart. So please try to code that. And if you are not confident in giving any medications or any tablets, you feel like you are not sure whether this allergy whether if patient is allergic to that or something like that. So if you feel like you are unsafe or you are not confident in giving the medication, just code it as other and state the reason and reassure them like you are not confident in giving this medication because you are unsure of the dosage or time or whatever it is. So you just reassure the patient, tell them like I will go back to the doctor, I will reconfirm the timing or the drug which needs to be given, and you will be going back to the patient. So that is another thing. And throughout the procedure you have to communicate effectively. Of course you have to see each medication side effects, you have to explain to the patient, and of course after each explanation you have to see whether the patient is willing to take or not. So do like that, and always see the patient is able to swallow the medication, and also ensure whether this medication has been really going into the patient. So it doesn't mean like whenever you take the medication in the pot, you're just going to sign the paper directly. You can just mark somewhere like a dot or something, just for your identification that it has been taken into pot. And once you ensure patient has been taken it or swallowed it, then only you come back and sign in each drugs or whatever drugs you have given. Okay, so that is the main thing you need to be careful in medication administration. So we'll see a scenario based station. So I enter the room, I see there is no hazards which cause any trips or falls. So also I will ensure enough privacy for my patient. I see the doors are closed and the curtains have been drawn. So before going to my patient, I will be doing a quick hand rub following the 7 WHO guidelines, that is rubbing your hands against palm to palm, back of the palms, fingers interlaced, fingers interlocked, fingertip rotation, thumb rotation, and finally wrist. So now I will be putting on my apron. And next I will be putting the gloves, assuming the package of this gloves is intact and in date. Okay, so we will be taking the prescription along with us. So the scenario which we are going to do here is like James Taylor were admitted to emergency department with complaints of chest pain, breathing difficulty, and diagnosed to have chest infection. And what is being asked to us is like, please administer and complete the documentation of their 12 hours medications in a safe and professional manner. So we are going to administer the 12 o'clock medication. So let's do that. Hi, good morning. My name is Trace. I'm one of the nurses who is looking after you today. Could you please tell me your full name, please?
Myself, Tom John.
Okay, and your date of birth?
19/3/28.
Okay, how would you like to be called as?
You can call me John.
Okay, John, would you mind me checking your ID details with your ID band?
Yes, please.
Thank you for that. So I can see your name is Tom John and your date of birth is 19/3/28 and your NHS number is 1234567. Alright, thank you for that, John. So now you have to see all these details like name, date of birth and NHS number is same in all the pages of your drug chart. So you have to cross check in all pages and just confirm everything got the same details. And next, like you have to confirm the allergies. Of course, this is medicine administration. Next is allergies. Hello, John. Could you please confirm, like, have you got any allergies?
Yes.
What are you allergic to?
It's penicillin.
Penicillin. And could you please tell me what actually happens when you take that?
I get rashes all over.
Oh, okay, fine. So I see our documentation got it written down, that is like penicillin, and the reaction has also been mentioned. Yeah, so don't worry, John, we won't be giving any penicillin and we will make sure that you won't be given any penicillin containing medication as well. Yeah. So John, today I'm here to give you some medications of your 12 o'clock medications. So that is going to take like a few minutes. First of all, I will be reading out all your prescription and I will tell you what are the side effects and the expected potential side effects also. So are you happy to do that now?
Yes, please.
Okay, can you confirm, like, have you got any pain?
Yes.
So if I ask you to score from 0 to 10, where 0 is the lowest and 10 is the maximum, where would you like to score your pain?
3.
3. So I think it's a bit mild at the moment. So do you think you need some painkillers?
Yes, please.
Alright, fine. So we'll do one thing anyway. I'm going to prepare the medications, and if I see you have been prescribed for some analgesics or painkiller, I will give you that, and if it is not, I will get it prescribed from the doctor and will get it back to you. Is that fine for you?
All right.
Alright, John. So I will be reading out the prescription for you.
Okay.
Okay, so now we will be reading out the prescription and we have to go through each and every drug separately and see whether it has got all the necessary details like drug name, dosage, route, time, doctor's name, bleep number. So if you're happy with everything, only you are going to give the medication. So let's do that. So the prescription which I got here is for Tom John. Date of birth is 19/3/28 and height is 1.57. Weight is 74. The ward is A&E. Date of admission is today and the consultant is Dr. A. Richards. Time of admission is 10. So all the prescribers names are being given along with their bleep number, and then the allergies has been mentioned as a penicillin. Also the reaction is there and the signature of the doctor, bleep number is also there along with the date. The next page also got the same details, ID details, and it has got 10 codes in case if you want to omit any medication, if you feel like you are not confident or you are not sure whether it is allergic or not. Better you don't give the medication, reassure the patient. You will see the prescription with the doctor and we'll get back to them. Okay, so all the codes have been given here. Next is once only medicines, pre-medication or antibiotic prophylaxis and patient group directions. So here today drug morphine sulfate 5 mg IV for pain was given at 7:40 a.m. Prescriber's sign, bleep number and signature is there. Also amlodipine 5 mg IV was given at 7:40 a.m. Doctor's signature and sign is there. Next page also got the same ID details. So it's mentioned like the patient is the patient a non CO2 retainer. It's not, so there is no oxygen prescribed here. And next page we see the same ID details given. And when we come to antimicrobials, so the drug is amoxicillin. Prescribed today, dosage is 500 mg, frequency is tedious, route is per oral, duration is for 7 days, prescribed for 3 times a day, and the prescriber signature, bleep number, everything is there. But since the patient is allergic to penicillin, and also amoxicillin contains penicillin, so I won't be happy to give that medication. So just tell with the patient that this is the situation. So John, I see like you are allergic to penicillin, and also you are being prescribed for amoxicillin which contains penicillin. So better I don't give this to you. I will go back to the doctor and will change the prescription, or I will get some alternative for this. So is that fine with you?
It's fine.
All right, fine. So the next medication is paracetamol, and it's been prescribed for today, 1 gram QDS. Route is per oral, timing has been given, and it is due for 12 o'clock. And also I see my patient's weight is more than 50 kg, so I'm happy to give 1 gram. And next is doctor's bleep number and name is also there, so the prescription is legible and valid, so I'm happy to proceed. But since it is paracetamol, of course you just go and check the PRN area as well. So we can see like paracetamol has been given at 10 o'clock today. So since it is 12 o'clock, it is only 2 hours apart from what the time has been already given. So better not to give, because we have to maintain a gap of 6 hours between 2 doses of paracetamol. So John, since you are prescribed for paracetamol and also you are asking for some painkillers as well, I see the previous medication was not effective. So better I will do one thing. I won't be giving you at this moment, because it is only 2 hours apart from the last dose. So if I give you now, it's gonna overdose you. So if you are okay, I will go to I will see if there is any alternative painkillers has been prescribed, and I will be giving you that. So is that fine with you?
Yes.
All right. So next is salbutamol inhaler, prescribed for today. Dosage is 200 mcg, 2 puffs. Frequency is BD. Route is inhalation. Duration is 5 days. Timing is like 8 o'clock in the morning and 10 o'clock at night, and it is not due at our time. So I will be moving to the next prescription, next drug. So that is ferrous sulfate, prescribed for today. Dosage is 200 mg. Frequency is OD. Route is per oral. Duration is it's ongoing regular medication, and it is due at 12 o'clock. It has got the doctor's name and the bleep number. So the next medication is ferrous sulfate. So prescribed for today, dosage is 200 mg. Frequency is OD, per oral route. Duration is been ongoing, so that is your regular medication, prescribed for 12. It's due now. Also it has got the prescriber's signature and the bleep number, so I'm happy to proceed with the prescription. So as I think you will be aware, because it's your regular medication, you are taking this because there will be some noticeable decrease in your iron level. So this ferrous sulfate is helping you to maintain your iron level in your blood. So are you happy to proceed with this medication?
Yes.
All right, thank you. So now I see I got the medication, that is ferrous sulfate, which is 200 mg, and the package is intact, and the expiry is within date. So I will be taking the tablet, taking 1 tablet into the lid, and just take it in your medication pot. So you'll be following an aseptic non-touch method to take the medication. So now you are going back to next medication, that is enalapril maleate, prescribed for today. Dosage is 5 mg per frequency is OD, route is peroral, duration is ongoing. So that is also your regular medication which is due at 12 o'clock. It has got the prescriber's name, prescriber's signature and the blip number. So I'm happy to proceed now with this medication. And I think you are aware of this one section as well, because this is a medication to help to control your blood pressure. So are you happy to take this medication?
Yes.
Okay, fine. So I've got the medication here, like an elapril maleate 5 mg. I see the package, the medicine container is intact and it's within date, so I'm happy to take it. So 1 tablet into the lid and transfer it to the medication pot. Close the container. Okay, so John, our next medication is digoxin. Prescribed for today. Dose is 200 mcg. Frequency is OD, peroral. Duration is for 7 days. And we are due. The medication is due now. The prescriber's blip number and signature is here. So the prescription is clear with all the details. And digoxin. Sir, could you please confirm what is the heart rate of John?
65.
Okay, 65. So I'm happy to give this medication because your heart rate is 65. John, this medication is to like control your variations on your heart rate, just to maintain your rhythm or heartbeats. So you are due now. So are you happy to take this medication?
Yes.
All right, fine. So I take the tablet. So I see this is digoxin, 200 mcg. The package is intact and the expiry is within date. So I take 1 tablet into the lid and transferring it into the medication pot. Close the container. Okay, John, the next is like a PRM medication, like that is not something regular which has to be taken whenever required. So first is paracetamol. Prescribed for today, dosage is 1 gram. So every 4 to 6 hourly. Route is per oral. It has been already given at 10 o'clock by one of other staff. So I can't give you another dose because it is already 12 o'clock now. So I will see for some other alternative for your pain. So I'll be leaving this now. So next is metoclopramide. It's prescribed with dosage of 10 mg, frequency TDS, route is oral, prescriber signature and blip number is there. John, could you please say, have you got any nausea or sickness, anything like that?
No.
Alright, fine. So I won't be giving this tablet anyway. And next is like this sheet also got the same ID details, the infusions. So today at 10 o'clock in the morning we had like normal saline infusion, 500 ml IV for over 4 hours. It's been given to you, is that correct?
Yes.
Alright, fine. So there are no other medications which I can see in your chart which is due for 12 o'clock. So John, can you please confirm, have you got any swallowing difficulties or anything like that?
No.
Alright, fine. So are you happy to take this medication?
Yes.
Alright, fine. So I got a glass of water along with a tablet here. So would you mind opening your mouth?
Yes.
Okay, just take it. Give water and take the tablet. Give the tablets one by one. Give the water and then ask the patient to confirm whether it has been swallowed or not. Then only you will be coming back and documenting. So John, hope you have taken all the medications and I can see there is nothing left in your mouth. So it has been gone in. So John, I will be documenting and I will be signing your drug chart here. And meantime, if you need any help, you can just use the call bell. Also, I will escalate your pain to the doctor and I will get some alternative painkillers for you. All right?
Thank you.
Okay, fine. So now you'll be coming back. Discard your gloves, your apron, do a quick hand rub. Okay, so now we are documenting. So first of all, you didn't give amoxicillin, which is due now because it is allergic. The patient is allergic. So in the last page, so here you will be putting the code 10 and signing, and then you will be going back, and here you got the space for omitted doses of medication. So put the date, time, name of the drug, dose, route, instructions, and reason for omission. Yeah, so signature, put your signature. So coming back to the next drug, paracetamol, that also you didn't give because it was given as a PRN dosage 2 hours apart from now. So put your signature and the code, and then going back to the last page and fill the page like same before. And then next is our ferrous sulfate we have given, so put your signature. Enalapril maleate you have given, put your signature. Digoxin we have given, your signature. Yeah, that's it. So we have completed our documentation. So if you have assured your patient that if you get some other medication, or if you have to cross-check some other medication, just go back, just say you will be going back to your doctor to escalate whatever it is necessary for the patient.